I had a patient come in last month who looked absolutely exhausted. She hadn't slept through a full night in 3 months. Every single night between 2 and 4 am, she would wake up, chest tight, gasping for air, frantically reaching for her blue inhaler. During the day, perfectly fine, but the moment her head hit the pillow, it was like clockwork. 3 am, struggling to breathe. She was terrified. She looked at me and said, "Dr. Paul, why does my body hit me at 3 am? Am I going crazy?" I had to tell her the truth. She wasn't going crazy. What's happening at 3 am isn't random. It's predictable. It's dangerous. And here is what terrifies me. Most people think waking up at night is just part of having asthma. It's not. Hello, I'm Dr. Suman Paul, NHS and private respiratory consultant here in the UK. Over the past decade, I have treated thousands of patients with asthma. And if you're using your blue inhaler more than twice a week at night, that's a medical red flag. It means your asthma is uncontrolled. In this video, I am breaking down the 3 biological reasons your lungs fail you at 3 am, the hidden bedroom triggers making it worse, and exactly what changes you need to make today to sleep through the night again. Before we go further, 2 quick but important points. I am a doctor, but I am not your doctor. This is educational information and not personal medical advice. If you ever have severe symptoms like chest pain, breathlessness at rest, blue lips, call 999 immediately. Now let's talk about why 3 am is the danger zone. There are 3 biological changes happening in your body while you sleep. I call it the perfect storm. The first one is the cortisol crash. Cortisol is your body's natural anti-inflammatory hormone. Think of it as your internal fire extinguisher. All day long, it helps you keep inflammation under control, but cortisol follows a rhythm. It peaks around 8 am in the morning when you wake up, and it drops to its lowest point between midnight and 4 am. If you have healthy lungs, that dip doesn't matter. But if you have asthma, your airways are already inflamed, like smoldering embers. When cortisol drops at 3 am, it's like taking the fire extinguisher out of the room. Those embers can flare into a full fire. That's when you wake up struggling to breathe. At night, your body simply has less natural protection against inflammation. The second one, the vagal tone shift. When you sleep, your nervous system switches into rest and digest mode, what we call vagal dominance. Your heart rate slows down, your blood pressure drops, your body repairs itself. But there is a side effect. This vagal state naturally tightens the smooth muscles around your airways. Imagine tiny rubber band wrapped around your breathing tubes. During the day, they are looser. At night, your nervous system gently tightens them. In healthy lungs, that might reduce airflow by 10 to 15%, barely noticeable. But if your airways are already narrowed from asthma, that extra squeeze can push you over the edge. You go from breathing okay to not okay very quickly. It's not in your head, it's physiology. The third point is gravity stops helping you. When you are upright during the day, gravity helps mucus drain away from your sinuses. But when you lie flat, that mucus drips down the back of your throat, called postnasal drip. It irritates your airways and can trigger coughing and chest tightness. And there is something even more overlooked. If you have acid reflux, and studies show 60 to 80% of people with asthma do, lying flat allows stomach acid to travel up the esophagus or the gullet and reach the back of your throat. You may not feel heartburn. This can be completely silent, but that acid irritates the nerves controlling your airways and can cause them to spasm shut. We call this silent reflux, and it's one of the most underestimated causes of nighttime asthma. So at 3 am, you have low cortisol, tighter airways from vagal tone, and gravity working against you with mucus and possibly acid. That's the perfect storm. Now let's talk about your bedroom, because it might be making things worse. The first one is dust mite. Your pillow and mattress contain millions of microscopic dust mite. They feed on dead skin cells and their droppings are a powerful asthma trigger. If you are breathing that in for 7 to 8 hours at night, it's constant low-level airway inflammation. It's like sleeping in a room with someone chain smoking, except you can't see or smell it. The second is cold air. Cold air irritates airways and causes them to constrict. If your bedroom temperature drops below 18 degrees Celsius or you are sleeping with a window open in autumn or winter, you may be exposing your lungs to a cold trigger all night. Many patients think fresh air will help. It doesn't if it's cold. Third, pets in your bedroom. I love pet, truly, but pet dander, tiny flecks of skin is a major asthma trigger. If your cat or dog sleeps on your bed, you are inhaling allergens for 8 hours straight at night. Your lungs don't recognize love, they recognize inflammation. Now here is a hard truth. If you are waking up at night with asthma symptoms more than once a week, your asthma is not well controlled, period. A better pillow or sleeping upright might help slightly, but those are band-aids. The core issue here is usually that your medication isn't strong enough to protect you through that 3 a.m. cortisol dip. And ignoring nighttime symptoms increases your risk of a severe, potentially life-threatening asthma attack. That exhausted patient I mentioned earlier, she was only using a blue reliever inhaler when symptoms appeared. She didn't have a preventer inhaler, the one that reduces inflammation long-term. I started her on a combination inhaler with a long-acting bronchodilator designed to cover the nighttime window. Within 2 weeks, she was sleeping through the night again. She didn't need a new pillow, she needed a proper asthma review. So what should you do? First, check your inhaler technique. Most people use inhalers incorrectly. If only 30% of the medication is reaching your lungs, it's no surprise you are waking up at night. If you would like a detailed video on inhaler techniques and common mistakes, comment yes inhaler video and I will create one. Second, treat the accomplices. If you have acid reflux, raise the head end of your bed by 15 to 20 centimeter using bed risers. Don't just stack pillows, that can make reflux worse. Avoid eating within 3 hours of bedtime. For dust mite, use allergen-proof covers on pillow and mattress. Wash bedding weekly at least 60 degrees Celsius. Keep your bedroom between 18 to 21 degrees. Close the windows at night if it is cold. And keep pets out of your bedroom. I know it's difficult, but your lungs will genuinely thank you. Third, and this is critical, if you are regularly using your blue inhaler at night, book a comprehensive asthma review with your doctor. If you likely need a preventer inhaler or smart therapy or some adjustment to your medication to cover that early morning window, lifestyle changes alone are not enough. This is exactly the kind of issue I help my patients resolve every day at my clinic. If you are based around Liverpool or the Northwest, you can book a comprehensive respiratory assessment with me using the link in the description below. I will identify your triggers, review your medications, and create a plan to stop these nighttime attacks before they start. Please don't wait for a 3 a.m. crisis. To recap, 3 a.m. asthma attacks happen because cortisol drops, vagal tone tightens your airways, and lying flat promotes postnasal drip and silent reflux. Bedroom triggers like dust mite, cold air, pet can make things worse. And night symptoms mean your asthma is uncontrolled. What you need is a proper medication review with the doctor. Sleep is when your body should heal, not struggle to breathe. If this video helped you, share it with someone who wakes up at night with asthma. It might genuinely change how they sleep. And if you want more clear, evidence-based respiratory advice, subscribe and stay with me. I am Dr. Suman Paul and I look forward to helping you breathe easier and sleep better very soon.